This three-story complex is going to be very, very important to our community because it is going to allow us to the first time in our community history to bring together all the primary care physicians in one center place. You'll be able to come to one building, one office, and you'll be able to be treated and seen by 14 different providers if necessary, or the provider of your choice. The first floor will accommodate specialties: surgery, orthopedic surgery, urology, cardiology, and hopefully, with the advent of this building, other specialties as GI, ENT, dermatology, rheumatology, or anything else that we can get specialists to come here to do.
The biggest challenge is having our patients walk a long distance from the parking lot to the entrance of our wound care center. It creates a big hardship on our patients that have wounds on their feet and can't walk that, extra step.
A new building will allow us to have better access for our patients, direct access to our office without going through the hallways. And there will be separate entrance for ambulance. We treat a lot of patients with problems with ambulation. They are delivered by ambulance. The new building will make it much easier. Also, we will play a little bit more bigger role in planning of how to situate certain rooms, modalities in the new building, and hopefully will improve comparing to the current situation.
We are isolating a wing of our new space, about 1,000 square feet, specific to pediatrics. It'll have a nice large pediatric gym with individualized rooms for occupational therapy, speech therapy, and physical therapy. We're looking to grow that area of our clinic. Additionally, there will be a space sectioned off specific to our student athletes in the region. It's going to be another 800 square feet that will just almost be specific to them, and then our general gym space will be open floor plan with all of our equipment to accommodate more spacing for patients, but also more spacing hopefully for more equipment.
Southwest of San Antonio, there's not a whole lot of options, and what we've looked at is being that county seat, if you will, for all things regarded to not only multi-specialty family practice and other subspecialties, but oncology. Oncology is such a needed practice, and we've been able to, through the team's efforts and investments, lock down some really great oncology providers from a hematology oncology and radiation oncology perspective. We're investing in new technologies. We're getting a new linear accelerator. We're remodeling the cancer suite. We're adding people to the team through care navigators, patient counselors, mental health presence in the area. So really to treat the holistic cancer patient, which is the hardest journey they'll ever go through. And we're trying to really be a pillar of excellence in the oncology, space.
The benefits of having the outpatient lab services is for the sake of, better pricing, the convenience of coming in to see your physician in the same building and being able to get your services, lab services, right there in time. We'll be able to provide the services you need.
We've had independent practice, for 20 years or so, but with current healthcare trends, it's become harder and harder to maintain that for ourselves, our employees, and our patients to have access to care in a rural community. So with discussion and looking at the merger, we'll be able to continue to provide the care that we were able to before, and actually in a more supported and better way for our patients as well as our employees.
The growth has been tremendous. It is a culmination, I believe, of an initial plan from an old administrator, Mr. Bender, who had an idea that this would be a central hub area, intermediate between San Antonio and the vicinity because of our growing area. And he always had a vision that is now just coming to fruition. The care that we provide here locally in our hospital is still personal care. When they go to San Antonio, the care is impersonal and you're a number.
Being able to have all the overhead cost and the resources under one umbrella, that's going to allow us to provide better care to our community. And we look forward to being able to do that.